Hi friends, today we'll be discussing about OBS and gynae for your practicals and RGHS obviously. So basically what I wanted to emphasize on the first fact is that it's for 200 marks. Okay, 1 second. Okay, it's for 200 marks. So this is what has been given by the university itself. So basically 160 marks. Okay. So this is what they wanted to say. So one obstetric case for 80 marks and one gynae for 80 marks and remaining 40 marks is for viva where one station comprises for about almost for 10 marks. Okay. So based on this, let us divide on what are the cases which we can expect for an obstetrics and a gynae case. So basically your 160 marks, let us divide it into obs and gynac. Okay. So ops is 80 again, gynac is under again 80 marks. So again, what are the things which you can expect in gynac? Because first let us finish off gynac because that's something which is important and also easy. It will be something related to fibroid, endometriosis or something related to that you might get, or something related to ovarian mass is something which you might get, and also something related to postmenopausal bleeding is also something evaluation. Okay, you won't get they will give just you something to do with postmenopausal bleeding or AUB or ovarian mass, something like that they might give you. And then one more important thing which you can expect is prolapsed uterus. This is the most common thing which you might get, this or this. Okay, so even this is important, but these two are core important thing which you need to know. Again, ops, it depends on what are the cases which is being admitted in your colleges, but which are the common cases which you can use. Obviously about GDM you can expect, about PIH you can expect, about anemia you can expect, especially about RH negative, though this is one of the core important things. This is something which is being as many times. Okay, I mean the patient load is high, so I just meant to say about that. And also about the mark presentation, it depends, but they won't expect you to do per abdominal or many kind of especially per abdominal examination. They would like to you just like to do it in a superficial way. They don't expect you to do in a deeper way. And also anemia, yeah, I have told you about that also. And also about majorly hydramnios, especially oligo or poly, both can be kept. Okay, either you might get oligohydramnios or polyhydramnios. Okay, so here what they will give you is about especially when you measure the SFH, it will either be increased or decreased. So based on that, you have to come to a conclusion after ruling out all of the differential and also clinical features which being presented by the patient. You have to come to that important thing also. Then again, I don't think they will keep APH or rheumatic heart disease because the number of cases itself is correct. Here you don't have a chronic patient. Okay, if a college knows a case of RHD in pregnancy, you don't expect her to conceive every year for exams, right? So that's one important advantage which you have. But these are the the basic ideas. You should know the important core things which are common in the society, I mean in the community. That's what they're being tested. So make sure you never forget this is like core which is important, which you should know. Okay, and also I'll be uploading all the vitamin A case discussion in the description. Please go and watch if you have a time. And again, remaining 40 marks, again core important itself. Again, let me divide it into 4 stations so that we will have an easy understanding on how to go about it. Okay, one station related to your fetal skull, especially that dummy, especially the that is dummy, pelvis and skull. No, especially what that is counted as demonstration station. Okay, one demonstration station is for sure. They expect you to know. Expect obviously one question which they will ask you about the stages of labor. How does the baby deliver? That is one important thing. Especially you should know every part of fetal skull. Especially the osteology part of anatomy. You should know all the sutures when it goes all important things. And also about the pelvis is something which which is important, which you should know. For example, gynecoid, which is most common, which is suitable for vaginal delivery. What are the complications? What is platypod pelvis? Everything they will ask. Especially the one thing which they will definitely ask about the labor part. So make sure you study accordingly. And one more important thing is about the instruments. Okay, instruments, especially again surgical and medical and allied, surgical and allied. As I have told you in pediatrics, again there are few things which is common both for surgery and ops also. But all the extra important things which you should know under instruments is that obviously you should know about the cuscus speculum. That is one important thing. And also you have to know about the instruments which are used in the cervical cytology. For example, that is liquid phase cytology. What do you do? All those brush and also while doing a C-section, what are the important instruments which you use, those things which you should know in and out, especially while studying an instrument, obviously about the indication, contraindication, what are the effects, everything you should know. That is one 10 marker also. This one 10 marker and this is one 10 marker. Okay, so next station is about your specimens. Okay, specimens and drugs and contraception. Okay, okay, specimens, they might ask you about the pathology itself. So pathospecimen is something which they will keep, or AB, or something related to fetal also they can keep. So it depends from college to college, but make sure you study that part also accordingly. One more thing is about the medications, right? Drugs and contraception. This you should know. I mean, you are passing MBBS, and if you don't know drugs and contraception, then you will be in a very difficult state in your PSM posting. So make sure you study about the contraception in and out. Especially they will give you all the mala dimala, and what are the saheli, all those things which is available in a clinical sociological setting, for example in a PHC, to be very superficial. So you should know how do you counsel a patient, and what if she misses a pills, how do you advise her, how do you go about that, everything in and out you should know about contraception. So that itself is a 10 marker topic. So major thing is, you can, though this comprises only about 40 marks, this is something which you should know and you would have studied. This is also something which you would have studied, I feel, but this too is something which you need to do. So basically, if you are ready with this thing day before exam, even if you just see things, I think you will be in a perfect position to manage things and stuff, so that you are not in a you are in a comfortable position to actually go about it and see how do you manage it. So basically, if you see the gist again, then basically you should know the case discussion part of it. So since it comprises from 160 marks, again divided into one ops and one gynae case, and remaining non-case based, which is 40 marks. Again, these are the important things which you should figure out, and think have a proper things in mind, and manage things. For example, here the major thing is about the Leapold's maneuver, that is abdominal grips, which you should know in and out. Now obviously, while doing a per vagina, you can just say that I would like to do a per vaginal examination, and they will give you the findings and you can present it accordingly. You place the decision, and basically here in obstetric, what is the major core is you check whether you know the management, that is what investigation and management, because here examination itself is quite limited because it's something to do with per abdominal, and in obstetrics the major thing is about the Leapold's maneuver. And again, you can use that same thing in the gynec, and you can check how uterus is of how many size or weak, and here you can in the obstetric part obviously have to measure about the symphysophondylite and all those important things. There are very limited things which you need to focus on ops, especially during examination. If you do that things perfectly and if you place the things accordingly, obviously you'll come to a conclusion and diagnosis. The major thing is about the management, and all the management itself is important, and you would have studied in theory itself, so it won't cost you more. So make sure this is one of the easiest practical, and is one of the easiest exam where you can score much. So study accordingly, and also obviously I'm sure you would know how to manage fibroid or postmenopausal bleeding or ovarian mass, because PMB itself is a 10 marker, right? So I'm sure you would know that. So study accordingly. This is what is given in the guidelines. So that's it. I wish you the best. Thank you.